So neurogenic rosacea is a new type of rosacea. It was first described in 2011, so not that long ago. And it's used to describe a type of rosacea that is primarily flushing, tingling, maybe a little bit of burning pain. Usually happens with heat and exercise. Tends to happen mostly in white females. So the reason it's different than other types of rosacea is it just doesn't really tend to respond as well to typical rosacea treatments such as oral antibiotics or topical antibiotics. It tends to respond better to things that target the nerves. So drugs like gabapentin, which kind of dull down nerve responses. Interestingly, a lot of these women in the studies also had rheumatologic disease, autoimmune diseases, pain syndromes, depression, anxiety. Other medications that tended to work were ones that targeted the blood flow, so like beta blockers. So I think the important thing to take away from this is that neurogenic rosacea really does have a different treatment algorithm than what typical rosacea. So if you're having those symptoms of rosacea where you're just having primarily flushing and numbness, tingling, dysesthesias, then it may be worth bringing it up to your dermatologist to make sure that you are on the right treatment regimen. Also, if you failed a lot of the sort of typical rosacea treatments, then it may be worthwhile going down another path of treatment. And it just goes to show that we're always learning things. Things are always coming up. We don't really understand a lot of the sort of basic underlying etiology of some of these skin conditions. More and more is coming out as better research is performed, and that we're always improving ways that we can take care of patients. As I'm getting ready, I'm noticing that I have a little bite mark on my nose from my 2-year-old. So that's having a 2-year-old for you.